Hello class and welcome to lecture 4. These are our learning objectives. We're going to be covering the anatomical position, learning about directional and regional terminology, showing you the body planes and sections, and the body cavities and regions. So let's get started. Anatomical terminology. We use this to describe certain areas and movements of the body and its relationship to each other. This just helps healthcare professionals to be able to communicate in the same language, basically, without having any errors and conflicting information in chart notes. So to start off, the anatomical position, it's a standard body position. The initial reference point is as follows. The body is erect, so that means standing straight up, feet slightly apart, palms facing forward, as you can see here, and thumbs pointing up or away from the body. Directional terms are used to describe one body structure in relation to another body structure. So when we use these, we are always talking about the terms as if the person was in anatomical position. So this one's very important. Right and left refer to the person or the cadaver being viewed, not the observer. Okay, so you're always talking about the patient's right or left, not yours. Example, the ears are lateral to the nose. Okay, that's saying that the ears are lateral to the nose, so away from the midline. Okay, we're going to get started with the different directional terms. So here when we look at this picture, the first one is going to be superior or cranial. Okay, this is towards the head and or upper part of a structure of the body or above. Okay, so for example, the head is superior to the abdomen. Okay, inferior or caudal, the definition of that is away from the head and or toward the lower part of the structure or the body. So below, so the navel is inferior to the chin. Anterior or ventral is toward or at the front of the body or in front of. Okay, so it's going to be in front of the body. Posterior or dorsal is towards the back of the body. Medial is toward or at the midline of the body or inner side. So it's going to just be towards the middle. Like the heart is medial to the arm, so more towards the middle. Okay. Lateral, away from the midline or of the body or the outer side. So lateral would be like away from the middle. Okay. Intermediate, between a more medial and a more lateral structure. So this one's kind of tricky, but for instance, your clavicle or your collarbone, okay, that is intermediate between the breastbone, which is your sternum, and the shoulder. So it's kind of intermediate in between those two. Okay, the next set is proximal and distal. So proximal means closer to the origin of the body or the attachment of the limb to the trunk. Okay, so basically it's going to be the elbow is proximal to the wrist, so higher up. So closer to the origin of the body part or the point of attachment of a limb to the body trunk. So you could say that the elbow is proximal to the fingers. Okay, also because the fingers are lower on that limb. Distal is farther from the origin of a body part or the point of attachment of the limb to the body. So where the limb attaches at the shoulder, it's going to be further than that. So the knee is distal to the thigh. Superficial and deep. So superficial or external means toward or at the body surface. So for instance, the skin is superficial to the skeletal system. So the bones are more deep and the skin is more superficial. All right, deep is away from the body surface or more internal. For instance, the lungs are deep to the skin. They're more internal than right at the surface. Okay, so regional terms. When we talk about the skeleton or the body, we describe it in two ways. We have the axial part, which this is our axis of the body, the main axis. This includes the head, the neck, and the trunk, without the arms and legs. Okay, whereas the appendicular part includes only the legs attached. Okay, so the arms and the legs, not the neck, the head, and the trunk part. So the axial part is basically our center core. The appendicular part is your arms and legs. Regional terms designate specific areas within these major body divisions. All right, so here's a list of terms that describe the major regions of the body from the anterior or ventral view. Each regional term is followed by terms that designate specific areas within that body region. So for instance, the cephalic region, this refers to the head and the face. The areas in the anterior cephalic region include the frontal or forehead, the orbital or eyes, nasal or nose, buccal or cheek, oral or mouth, and the mental chin. Okay, the cervical region refers to the neck. The thoracic region refers to the chest. The areas in the thoracic region include the sternal or the sternum. We call that the breastbone. The axillary is also the armpits, and mammary are the breasts. The abdominal region refers to the abdomen, so like your stomach area. The abdominal region includes the umbilical area, near the umbilicus or the belly button. The pelvis or the pelvic region refers to the pelvis. The pelvic region includes the inguinal growing area and the genitalia area. Upper limb, this region refers to the arms. The area in the upper limb region includes the acromial, the shoulder, the brachial, which is arm, antecubital, which is the anterior elbow, the olecranon, which is the posterior elbow, that's your funny bone when you hit it. Antebrachial is the forearm, and the carpal is the wrist. All right, the manus region refers to the hands. The area in the manus region include the pollex, the thumb, the metacarpal is the posterior hand, the palmar means the palm, and the digital areas are the fingers. The lower limb region refers to the legs. Areas of the lower limb include the coxal or the hip, femoral is the thigh, the patellar is the anterior knee or your patella, the popliteal area is the posterior knee, the back of your knee. The crural is the anterior leg between the knee and the ankle. The sural is the calf or posterior leg between the knee and the ankle. And the fibular or peroneal is the side of the leg between the knee and the ankle. Okay. Down here, where it says pedal, the pedal area refers to the foot or the pedal. Like when you're riding a bike, you're hitting the pedals. Remember, that's your foot area. Areas within the pedal region include the tarsal or the anterior ankle, the calcaneal, the posterior ankle, the metatarsal, which is the anterior foot between the ankle and the toes. The metatarsal, oh, I already said that. The digital is the toes, the plantar is the sole of your foot, and the hallux is the great toe, or the big toe. All right, here's a list of terms that describe major regions of the body as seen from the posterior or dorsal view. Each regional term is followed by terms that designate specific areas within that body region. Okay, cephalic region refers to the head or face. Areas in the posterior cephalic region include the otic or ears and the occipital or the back of the head. Okay, the dorsal region refers to the back or the dorsum. Areas in the dorsum region include the scapular or the shoulder blades, the vertebral spine, the lower lumbar back, the sacral or the tailbone, the gluteal or the buttocks, the perineal, between the anus and external genitalia. The upper limb region refers to the arms. Areas in the upper limb have the shoulder or the acromial, the brachial or the arm, the antecubital, anterior elbow, olecranon, posterior elbow, the antebrachial forearm and carpal. The manus region refers to the hands. These include the pollex or the thumb, the metacarpal, the posterior hand, the palmar, the palm, and the digits are the fingers. The lower limb region refers to the legs. These include the coxal or the hip, the femoral or the thigh, the patellar, which would be the anterior knee, popliteal would be the posterior knee, the anterior leg between the knee and the ankle. The sural is the calf or posterior leg between the knee and the ankle. We have the fibular or peroneal side of the leg between the knee and the ankle. And remember, the pedal area refers to the foot. This has the tarsal, the calcaneal, and the metatarsal areas. The digits, the plantar or the sole of the foot, and the hallux, the great toe. Okay, so we're going to move into body planes and sections. So the body plane is a flat surface along which the body or its structures may be divided or anatomically studied. The most common ones are the sagittal, the frontal, and the transverse. So it divides the body or the organ into sections. It's a cut through the body or its structures that is made along a particular plane, which they're going to be labeled as these planes. It's named after the plane. For example, a cut along the sagittal plane results in a sagittal section. Okay, for this one, the body planes and sections, we're going to talk about the sagittal plane. So the median or sagittal plane runs along the midline to divide the body vertically into right and left parts. This produces a median or sagittal section. Okay, the mid-sagittal plane, so this kind of goes right down the midline. Okay, so a parasagittal plane is a sagittal plane that is offset from the midline. Okay, so that would mean if you take this piece of plexiglass and shift it either to the left or the right, now you don't have equal body parts on right and left. Okay. The frontal plane or coronal plane divides the body vertically into anterior and posterior parts, so front and back parts. This produces a frontal section through the body. So this would be the plexiglass going right through the body from the side. And this is how it would look on an MRI. So see here you have the shoulders, the heart. It's like taking one slice out. A transverse or horizontal plane divides the body horizontally and into superior and inferior parts. Okay, so this would be taking that plexiglass, sliding it right through the section there, and you're going to have a superior and an inferior section. And then this is what it would look like on an MRI. So think about if you take that plexiglass out and turn it so that you can see it, this is what it would look like, cross section. The oblique sections, these are results of cuts other than at right angles. So they don't usually use these too often. They can be difficult to interpret. So I wouldn't worry about that. Okay. Next, we're going to talk about the organs. The internal organs lie in membrane-lined body cavities. So the body contains internal cavities that are close to the environment. These cavities provide different degrees of protection to organs within them. So there's two sets of cavities, the dorsal body cavity and the ventral body cavity. So this is the dorsal body cavity. It protects the fragile nervous system. Okay. The skull and the spinal cord is seen very clearly here. The rib cage, abdomen, and pelvis are also clearly indicated. So there's two subdivisions, the cranial cavity, which encases the brain, that would be up here, and the vertebral or spinal cavity, which encases the spinal cord, right here. These are covered by membranes called meninges. The ventral body cavity houses the internal organs, collectively called the viscera. Two subsections or subdivisions that are separated by the diaphragm. So we have the thoracic cavity, which is two pleural cavities, each surrounding one lung. The mediastinum. This surrounds the other thoracic organs, such as the thymus, parts of the trachea, and esophagus. And it contains the pericardial cavity, which encloses the heart. Okay, so that's the thoracic cavity. The abdominopelvic cavity is the abdominal cavity that contains the stomach, the intestines, the spleen, the liver, and the pelvic cavity, which contains the urinary bladder, reproductive organs, and rectum. Okay, so here's a list of the major body cavities with the smaller cavities into which they are subdivided. The body structures contained in each cavity. Okay, so the dorsal cavity contains the cranial cavity and the vertebral cavity. Okay, so here the dorsal cavity contains the cranial cavity and the vertebral cavity. So the cranial cavity is located inside the head and contains the brain. The vertebral cavity extends from the head to the tailbone and includes the spinal cord. All right. Let's keep going. The ventral cavity over here contains the thoracic cavity and the abdominopelvic cavity. So here it's showing the thoracic cavity and then the abdominopelvic cavity. The thoracic cavity is subdivided into superior mediastinum, the pleural cavity, and the pericardial cavity within the mediastinum. All right, so let's take a look at this picture. The thoracic cavity contains the heart and the lungs. You're seeing that here. So over here on this front view, we see the lungs, we see the heart in the middle, and the superior mediastinum. Here between these two compartments, the thoracic cavity and the abdominal cavity, is the diaphragm. Okay, you're going to see this on both views. The abdominal cavity contains the digestive viscera. So that's going to be your stomach, your pancreas, your liver, and so on. And then the pelvic cavity, right down here, is going to have everything that's in your pelvis, which is the urinary bladder, reproductive organs, rectum. All right. Okay, so when we have some problems, we have homeostatic imbalance. So problems can occur when structures stray into neighboring cavities. Examples, a hiatal hernia. This is where part of the stomach protrudes through the diaphragm into the thoracic cavity. So if you've ever seen someone, a lot of times when they flex their abdominal muscles, usually I see this a lot when a patient is trying to turn over on the chiropractic table. So they're, kind of raising up. That puts pressure into the abdominal area, and you'll see like this lump come up out of their stomach. Okay, that's usually an abdominal hernia, but it's basically the same thing, something going into another cavity. So this can push stomach acid into the esophagus, causing irritation or heartburn. And in severe cases, it can require surgical repair. Oftentimes, when people have these, they can get stuck to where they're in a severe pain until that little part goes back into the original area where it's supposed to. All right, moving on, the ventral cavity, the ventral body cavity. This is going to include the membranes in the ventral body cavity. We have the serosa, also called the serous membrane. This is a double thin, double layered membrane that covers surfaces in the ventral body cavity. The parietal serosa lines the cavity walls. The visceral serosa covers organs, the viscera. Because remember, we were calling the viscera is the organs in the cavity. Slit-like cavity between two membranes is filled with lubricating serous fluid. And this fluid is secreted by both layers of the membrane. All right. So in part A, the outer wall of the balloon is comparable to the parietal serosa. Okay, that's this here. The serous membrane that lines the walls of the ventral body cavity. Okay, so that's going to be the serous membrane that's from the abdominal cavity. The inside air in the balloon is comparable to the serous cavity in here. So that's the cavity. The inner wall of the balloon is comparable to the visceral serosa that covers the organs inside the vertebral body cavity. So a fist thrust into the flaccid balloon demonstrates the relationship between the parietal and the visceral serous membrane levels. Okay. All right. These ventral body cavities are named for what they're associated with. Okay, so we have the pleura. Okay, this lines the pleural cavities. The visceral pleura covers the lungs, etc. The peritoneum, the parietal peritoneum lines the walls of the abdominopelvic cavity. The visceral peritoneum covers most of the organs in that cavity. And the pericardium covers the area around the heart. All right, this picture is showing the serosa associated with the heart. The parietal pericardium lines the pericardial cavity. It folds back as the visceral pericardium, the serosa that covers the heart. Between the parietal pericardium and the visceral pericardium is the pericardial space, which includes the serous fluid. Okay, so here's the parietal pericardium, this outer layer. The pericardial space, which is the inner layer, that's filled with the serous fluid. And then we have the visceral pericardium. This is the very inner layer of that, and that's what covers the surface of the heart. All right, when there's problems with those membranes, we get homeostatic imbalance. So the serous membranes can become inflamed if they get infected or the person has some type of bacterial problem or a virus is in there. So normally these smooth layers provide help with reducing friction. Okay, if they become rough, they can irritate each other as they rub against each other or stick together. Whenever that happens, it's excruciating pain. Examples of that is pleurisy, where the pleura is inflamed, or peritonitis, where the peritoneum is inflamed. All right, we're going to start the cavities now. The abdominal pelvic region and quadrants. Doctors and nurses, medical personnel, they use this to help identify certain areas. Because if someone comes in and they're pointing their abdomen and they say, I have pain here, a broad way to kind of describe that is pain in the left upper quadrant or lower right quadrant. Okay, so basically they take your torso, they put a vertical line down the middle, a horizontal line there, usually at the belly button, and then now we have the patient's left upper quadrant, the patient's right upper quadrant, the patient's right lower quadrant, and the patient's left lower quadrant. Remember, we're always going by what the patient's right or left is. All right, in this image, we have the human torso. It's subdivided by two transverse planes, right here, and two parasagittal planes. So remember, sagittal is right down the middle, parasagittal is offset a little bit. This produces the 9 abdominal pelvic regions. The superior transverse plane is inferior to the ribs. Okay, so the ribs are going to come down here. It's just below that last rib. The inferior transverse plane is just superior to the hip bones. The two parasagittal planes here lie just medial to the nipples. Okay, so the nipples are here a little bit medial towards the center. Okay, so above the superior transverse plane, we have 3 abdominal pelvic regions. It is the right hypochondriac region, the epigastric region, and the left hypochondriac region. Between the 2 transverse planes, the 3 regions are the right lateral lumbar region, the umbilical region in the center, and the left lateral or lumbar region, right in here. Below the inferior transverse plane, the 3 regions are the right inguinal iliac region, the pubic or hypogastric region in the center, and the left inguinal iliac region. Okay, so epigastric is like by the stomach. Umbilical is going to be the center by the umbilicus. Pubic is down by the pubic area. Okay, that's your center cavities. Now we go to the left side, left hypochondriac, the left lateral lumbar. So here's the lumbar spine in here, left lateral lumbar, and then the left inguinal or iliac region. Your iliac bone is here. Same thing over here. The right inguinal, the inguinal ligament is in here, and the iliac is right here. The right lateral lumbar, so here's the lumbar, and go to the right is the right lateral lumbar region and the right hypochondriac region. Okay, so that's the 9 abdominopelvic regions. This picture is showing you what some of the organs are in those regions. All right. So when we have errors, you can have a doing surgery on the wrong site. Critical surgical errors may result from confusion about right versus left, poor understanding of terminology. Example, amputating the wrong leg, doing the right instead of the left, because you were talking about your left, not the patient's left. Okay, so these are very important to get to be using these terms in your daily terminology if you can. Especially when you're studying through your textbook and your notes, when you're describing those things, just like I did in that last picture, use your mid-sagittal and your transverse terminology, because that's how you're going to really get to know it really well if you start using it. Okay, we have some other body cavities. So in addition to the two main closed body cavities, we have some smaller ones. So we have the oral. So these ones are open. They're exposed to the environment. The oral and the digestive cavities. So basically your mouth, it contains your teeth, tongue. It's continuous with the cavity of the digestive organs, which goes all the way to the anus. Your nasal cavity, which is within your nose, part of your respiratory system. Your orbital cavities in the anterior skull, which house your eyes. The middle ear cavities in the skull, medial to the eardrums, contains tiny bones that transmit sound vibrations for hearing. Okay, and then we have some closed body cavities that are not exposed to the environment. Synovial cavities. These are enclosed cavities within fibrous capsules around freely movable joints of the body. Okay, so those would be like your knee joints, your elbow joints, your shoulder joints. They all have synovial cavities with that synovial fluid in them to help with reducing friction. Synovial membrane lining secretes synovial fluid to lubricate the joint in each of those joints. And that's it.